Could you introduce yourself, please?
I will, of course. Thanks for having me, Mary. So my name is Frances Burke and I'm one of the midwife educators here in the hospital.
My first question is, what happens in pregnancy?
Okay, so basically I suppose we say pregnancy is a very special time for a mother and their family, and there are a lot of changes that happen in pregnancy. So we talk about pregnancy split into 3 parts, and they're called trimesters, and they're nearly in blocks of 3 months. So you have 3 months, and then another 3 months is 6, and then up to the 9 months and your pregnancy. A lot of body changes, a lot of kind of emotional changes and physical changes for the mum. So I think it's very important that for the mum that she tries to keep as well as she possibly can. So we know we would definitely recommend mums to take folic acid up to the 12 weeks in pregnancy. So lots of women would know that. Keeping healthy, eating healthy, keeping physically kind of fit, and I suppose mentally keeping positive as well. So I do think a lot of mums do feel a bit very mixed about the pregnancy, because not a lot of pregnancies are planned as we know it. So it can be a challenging time, and with worries about maybe financial and how you're going to manage. I think definitely you would need to seek maybe support. Family and friends are probably the best supports that mums have to help them. There are professionals in the hospital as well, and the clinics that will help. So I think it's opening up, looking for support, look for the midwives they're meeting, and maybe to mention to them how they're feeling, and especially if they haven't family support.
I know that when you have the booking in scan and you have your appointment, your partner is usually involved with the scan. Is there any other way that a partner can offer support?
Definitely to sharing the amazing journey. Sometimes offering a shoulder to cry on, even though the partner may not realise why they're crying. It's an emotional journey. Supporting household chores, maybe making sure healthy eating and that they're getting a little bit active and remaining positive together, really.
I know that expectant mothers has to attend some appointments. What do those appointments involve?
Yeah, so the first appointment is probably one where the GP has sent the mother up to the hospital for the pregnancy. And that is the first appointment where they're going to meet really the midwives for the first time. They'll have maybe a history appointment where they'll be asked about have they got a history, medical history and history of having babies, and generally how their health is. And then they'll also maybe have the very first scan. From there on then they may not need to be seen for maybe another month or 2. And then it becomes more regular the more pregnant they are. So from about 28 weeks, maybe they need to be seen every 2 weeks, and from 36 weeks in pregnancy every week. And every time they get seen, they usually have their blood pressure checked, their urine checked, their well-being and the baby's well-being.
And isn't there some sort of a blood test, Frances? Isn't there a blood test offered at some of those appointments?
Yeah, so the very first appointment we actually offer a full range of blood tests, and they're like a health check on the mum. So they're really checking how well she is. They're also checking things like HIV status, if they have any infections in their system.
Can you tell me when first expectant mothers get their scans?
So the
How many weeks are they?
Yeah, that's a good question. The first scan we try and do is between 12 and 14 weeks, and ideally around the 12-week mark. And all they're really doing in that scan is checking, is there a pregnancy that looks that it's viable? Does it measure right? And is there a heartbeat? So is the mum pregnant? And can we see a heartbeat? And we're happy then. So we would always then recommend a further scan for a little bit later on, maybe about the 19 to 22 weeks. And we're checking other things then in that scan.
Frances, when all these scans are over and done with, will I get other scans? Will I need them?
Yeah, so I think that's a good question as well. So the second scan we do is around, as I said, maybe the 19 to 22 weeks. And we are checking a lot of things specifically with the baby then. So we're a lot more detailed in the scan. The baby's that bit bigger. So we are checking the brain, the baby's heart, the stomach, kidneys, bladder, the arms, the legs, hands, feet, and also where the placenta is, the afterbirth. Now, if everything is normal, and we say pregnancy is a normal life event, a healthy normal life event, you may not need other scans. But certainly every time you have a checkup, if they were any concerned or you were concerned, they may say to you, we'll rescan again. So we do have mums who have scans later on, but you may not need it either if the baby's growing well, and we'll know.
Thanks very much, Frances. I enjoyed that chat. Is there any key messages you'd like to get out there through this recording, or maybe as myself as a community health worker?
Yeah, so I mean, it's lovely to meet you, Mary, and I think the role you play is vital for these mums.
Thanks very much, Frances.
I think if they can be as informed as they can about pregnancy is really useful, because there's a lot of fear and anxiety for mums, especially first-time mums when they come in. So we want to get them to come in positive and relaxed. The more relaxed they are, the better it is for them and their baby. So, not to be afraid to come to classes, get more education, and tend to their appointments. And then if they've any worries, at those appointments to ask the questions.